Hello, I'm Bruce Wolcott. I'm with the Northwest XR EDU network, and I'm talking this morning with Teaessa Chism and Kelsie Powell. They are both working with XR technologies in the realm of teaching nursing care procedures with nursing students. Teaessa is with Bellevue College. Kelsie is with Chemeketa Community College near Salem, Oregon. And we're going to begin with a few questions. This is going to be for our OER content, and they have a lot of experience working with VR and simulations for nursing training. So without further ado, I'm going to introduce both of you, a topic for both of you, and then we'll just go through from topic to topic. And if you could just talk with each other about your experiences in each of these, that would be excellent. Okay, so our first question this morning is, what is the value of immersive virtual reality experiences in nursing training? And Kelsie, you're nodding your head, so if you could start that for us.
Okay, awesome. Thank you. Happy to be here and talk about this subject. So I think that a common question that comes up is, why do virtual reality simulations in any program, nursing program? We have high fidelity simulations with mannequins. We also usually have lab space where they can practice their skills. So what is the value of VR? And I think one thing that I'd like to really highlight, and then Teaessa, I'm sure, has plenty of to highlight as well, is this concept of serious gaming or gamification. And the research has shown that this concept of serious gaming, doing some sort of gaming in learning in this serious manner, it just has a lot of benefits. So it improves student satisfaction. It really helps students develop these like non-technical skills, such as like communication, situation awareness, in the nursing world, critical thinking, time management. And it's really perceived by students as sort of educationally valuable and fun in a way that has reduced stress because they have sort of this gaming aspect to it. And VR specifically, beyond just serious gaming, has been shown in research that it enhances clinical reasoning, and students do experience less stress. And we know if students are experiencing less stress, then they're able to retain more, learn more, and gain more from the experience. Another piece to VR simulations that's really interesting, especially compared to your high fidelity simulation with mannequins, is that it has some financial advantages as well. So I think one research study showed that VR requires about 22% less time, like faculty time, than high fidelity simulation, and then a total of 40% less like monetary costs in high fidelity simulation. So you usually need less people. And the startup costs, sure, you need the headset and then whatever program you're contracting with. But beyond that, there's less cost associated with it than your mannequins. So the two things that I really like to highlight is that piece of like serious gaming, gamification, creating an environment where students can gain a lot and also feel more comfortable and have fun with it as well. And also some of these financial and time advantages as well.
I have to say, I agree with Kelsie. That's a great question of why virtual reality versus high fidelity simulation, especially if your program is already vested in high fidelity simulation. I don't see one of the experiences replacing the other. I see the value of both of them, specifically what Kelsie was sharing, that gamification. And I've had student feedback suggest that the virtual reality, it's more immersive, right? It feels more real. And I think students appreciate that piece of it. And then also the financial aspect I found. And then I think that it appeals to just different generational learners as well. And I think that that can really help with ease that stress and that anxiety.
So Kelsie and Teaessa, what do you consider to be the best teaching practices for nursing simulations based on your experience so far?
Yeah, great. Well, one of the things I think about the best teaching practices, and one kind of just hitting on that value of virtual reality well, and Kelsie mentioned this, is that clinical reasoning development, right? So virtual reality allows students this this immersive learning experience to step in and develop that clinical judgment, which is so important for our graduates to develop, and it impacts patient safety. And really for that to be, effective, when you look at the literature, we really do need to engage in best teaching practices. So we can't just go in there and say, okay, we're going to wing this, right? So I think one of the best practices with virtual reality is really using the International Nursing Association for Clinical Learning and Simulation Standards, or ANACSL, as we call them in nursing education, is really foundational and important. So the first thing that you want to do is really look at those standards, establishing like a needs assessment for your curriculum, finding out where your gaps are, and then tailoring your virtual reality experience to meet those gaps. And so some of the best standards of practice really involve helping with curriculum alignment after you have that needs assessment done. So how are the virtual reality outcomes? How are they relating to your course outcomes? How are those relating to your program outcomes? After you have that mapped out, then the best practice is to have students have some type of a pre-learning, right? And Kelsie and I will talk about this later. There's different programs that offer different pre-learning opportunities. So sometimes students, that pre-learning may look a little bit different, but it's often referred to as like a ticket to simulation, ticket to virtual reality. And that really gives students an opportunity to engage with and know, have that foundational knowledge of what the patient they're going to be caring for. And then after that, you want to have a pre-brief or a huddle where students are able to talk about the patient scenario, kind of plan care, if you will, talk about their ticket to simulation. And then after the simulation, the most important piece, and the literature supports this, is the debrief process. And you want to ensure that you're using an evidence-based model during this debrief process to help pull out that clinical reasoning, that student's reflective practice, and really establishing that psychological safety where students feel safe, they know they can be vulnerable. The whole idea is to examine where we made mistakes and how we can improve from those mistakes. So those are some of the things for best practices I found really beneficial.
Thanks, Teaessa. I couldn't say it better. I think that you covered it really well. One thing that I really wanted to highlight that you said is this sort of needs assessment and seeing the gap. And one thing that if you're in nursing education or in the field at the bedside, one thing that educators hear over and over again is, your students are great, your program is great, but there's this gap from theory to practice. And I think anything that we can do to improve our curriculum and our programs to help decrease that gap from, hey, I'm in school, I learned these things. Oh my gosh, now I'm at the bedside practicing these things. And I think VR is one of those things that for every program can really help close that gap and just complement, as what Teaessa said with the last question, is I don't think VR should be replacing anything, certainly not at this stage, but it is a great complement to what you already have to just add on and incorporate these pieces that are really difficult to learn, that clinical reasoning, the critical judgment, those things as well. So, yeah.
Okay, we're coming to our third question. And what are some common teaching challenges using VR-based nursing simulations, and how do you navigate those? What's your experience with that?
I think to start, this reminds me of, Bruce, a conversation that you and I were having just before recording this. And one of the sort of take a back a step big pieces is of incorporating something like this in your program is money, of course, but then time as well too. So finding, a faculty or multiple members of the faculty that are able to dedicate the time in learning and figuring out how to implement this, what program to go with, and then getting the stakeholders on board too for you need the space, you need some sort of space to work in a virtual reality. And then you need the equipment, the VR headsets and whatnot, as well as the program that you're subscribing to. And so I think that is one of the biggest challenges, taking a step back of like, okay, how do we even get it in our program? So hopefully some, resources like this can help it feel more achievable and attainable by different programs. But I think to me, that's the first thing that comes to my mind is, okay, actually getting it into your program.
I would agree, Kelsie. I think that one of the common challenges, and you mentioned this, Kelsie, is that buy-in piece, right? So kind of like think like, why do we need virtual reality, right? We already have simulation. We're doing fine in our program. And again, it's going to meet those different generational learners' needs, and it helps like reduce some of that stress. And I think sometimes that can also be a challenge, right? That you have to overcome to get that buy-in. As you mentioned, Kelsie, having a lead person who is kind of your lead, and you develop your team and you demonstrate this is a gap in our curriculum. This is what the literature is supporting right now. This is the value. This is the cost value. This is the projected budget, right? Those can be challenges. And then also, I think on the student side and the faculty side, we all have different generational learning styles. And sometimes with our baby boomers, that can be a challenge, I think, with the learning style and embracing that change and that challenge with technology. Whereas more of, and even the Gen X sometimes, and then was more of millennials, they love it. They're like right there in it. It's kind of second nature. So that can be a really big challenge. And then the technical glitches, which I think, Kelsie, you mentioned this as well. You really have to have that time for faculty to train and be comfortable with it. Because if your faculty member is stressed and frazzled, that trickles down to the students as well. And it's not an enjoyable learning experience.
So one really quick last question. This has to do with the two VR systems that you're working. Kelsie, you're working with the UbiSim application. Teaessa, you're working with SimX. Any quick summaries in terms of your experience with those programs, and any recommendations you have for people who are working with that particular system?
Well, I'll just briefly state that I think there's a lot of different programs out there, and I think it's for each college to decide what program is going to best meet their learning needs. What I would suggest for that is, number one, doing that needs assessment. What are your curriculum gaps? What does it look like for your faculty support? Do you have an XR lab team on board that can provide that support with you? And then reaching out to those different companies to get some demos, right? So having them come in, do demonstrations, having faculty discussion about that. Those would probably be those would be my suggestions and kind of my experience of how we've kind of shifted looking at different products.
Yeah, absolutely. I agree. I think that one thing that could be helpful is if anyone has time to go to a conference or a convention like NLN or NASCL itself, usually in their exhibit halls, a lot of the different programs will come and you can trial them right there. And even if you don't have time to do that particular conference, you can do some research on your own and then reach out to these companies. And oftentimes they will even come to you or let you try it virtually as well. So you can see, oh, this is a good match. And for us, I think we narrowed it down to 3, and we were able to get trials on all 3, and we had all the faculty come in to try all 3, and sort of we were able to vote on what we thought was best for our program and our needs at the time. And it's evolving. I think it's really interesting. I just met with one company that pretty much their entire VR program is AI. So right now, the program I personally use is I'm on this side facilitating it on a computer to have the patient respond in the ways that I'm clicking them to respond. But this one program, they're using AI so that the patient is immediately talking back using AI. And it was just really fascinating to see, and really unique for something like taking care of sort of psych patients and different diagnoses in that world. And you can interact with someone who maybe is diagnosed with schizophrenia or depression. And it's just even more immersive on that communication level. So again, like exactly what Teaessa said, I think figuring out what a needs assessment for your program, seeing what's out there, giving it a try, and figuring out the best fit.
Yeah.
Kelsie, I think you brought up something interesting, which is the impact that AI is having on VR in general, and that's a whole other territory to look at some point. Well, I want to thank both of you for talking about the great work that you're doing and contributing to the OER process for the NSF grant. So thanks for your time and thanks for your expertise.
Thank you, Bruce. It's been great to be here and work with you guys and talk about this, and I love it.
Yeah, thank you, Bruce. I appreciate you. And I think that this collaboration is so important and so key, especially as we look at expanding virtual reality. It's so important to generate relationships and work collaboratively together to help work on projects and have data to support virtual reality.
Yeah, absolutely. And, Teaessa and I are in two entirely different states. So it's just amazing. We've never met in person, and it's amazing to be able to collaborate like this.
Okay, thank you.